May is Mental Health Month, and look, it seems no matter where we go right now, the conversation around people's state of mind is front and center. It's the world we're living in. It just is a baked in part of it. So Mental Health Month is really not exclusive opportunity to have these discussions, but it's a good one. And that's what we're going to do today, coping really with the reality of what a lot of people are facing on a day-to-day basis, which is the impact of post-COVID loneliness, affordability, just a general sense of transition and uncertainty that, again, it just permeates throughout so much right now. Before we get into today's conversation, I guess the smart thing to do is for our guests to introduce themselves. We'll start with Jen, so we can associate the voice with a person.
Hi, my name is Jenny Tu. I am the Senior Director of Integrated Behavioral Health at Rhode Island Public Health Institute and Open Door Health, and independently licensed clinical social worker by training.
And Dr. Wallace.
Hey, I'm Paul Wallace. I'm a psychiatrist here at the Providence Center, as well as Open Door Health. I'm the medical director at the Providence Center and on the clinical faculty with the Brown Department of Psychiatry and Human Behavior.
All right. Well, it's not uncommon here in Rhode Island, like the rest of the country, to hear that we're in something of a mental health crisis. So let's go from each of your perspectives. What's driving this right now? What's driving the current state of mental health, at least as it's perceived by so many of us and obviously by so many of us experienced as well?
Yeah, I think we've seen just a gradual increase in the exacerbation of people's ability to cope and manage with life since sort of COVID and since the pandemic. A lot of increased isolation and even, a mismatch of how people balance their lives pre-COVID and sort of balance their lives now, and a lot of adaptability around sort of telehealth and virtual work and things like that since then. And I think we've just continued to see this spike in lack of access, difficult barriers to care, insurance barriers, maybe uninsured barriers, and with a world that continues to evolve and shift in lots of tricky ways, it's exacerbated people's capacity to manage how that's impacting day-to-day functioning.
Dr. Wallace, same question.
Yeah, I would give you the imagery of the frog boiling in water, where things over a long period of time, you could say decades, have slowly broken down in our society, and modern technology probably bears some responsibility for that. Fracturing of community and some of the community supports that provides a lot of mental wellness and support to community members have slowly fractured. Take a book like Bowling Alone, that was written by the Harvard sociologist Robert Putnam over 2 decades ago, that describes some of those differences, and that trend has only accelerated in recent years, have contributed to this worsening mental health collectively in our society. And then to paint a somewhat rosier picture as far as mental health goes, I think there's an increased awareness of people who are suffering from mental health conditions, which is, when I say that's a rosier picture, I mean in the sense that, getting treatment, getting care starts with awareness that there is an issue. And whereas decades ago, a lot of things were probably kind of buried in the closet, nowadays more and more people are coming forward and asking for help around mental health conditions, which is great. But it does lead to the end result of there being a much increased demand for mental health services than in the past.
How much of it is an increased awareness that has led to an increased diagnosis rate or an increased appetite for a person that's suffering to be able to step forward and say, hey, I want to investigate this at some level, even if it doesn't lead to a full-on diagnosis? How much of it is really just people responding in the moment because of kind of a collective sentiment that it's okay to not be okay?
Yeah, I think that's been a positive, and we could spend hours debating the merits of social media and the internet in terms of raising awareness, for these sorts of things, and all other ways in which social media and the internet have affected mental health. But I think too, you know, think of like the greatest generation that came out of World War II, and this idea that the men and women who came out of that conflict, were these strong, like Teflon individuals who had triumphed. And now we know with increased awareness, there was lots of PTSD that came from that war and everything that going on in the globe around that time that just simply was not named, and it happened. It was kept behind closed doors. Nowadays, more and more, and not to say that sort of penetration of mental health awareness has permeated every aspect of our society. We're far from that. But there are more people who are exhibiting different symptoms that do talk to a therapist or their primary care doctor or see a psychiatrist like myself.
Jen, kind of to that point, what do you see or what are you hearing from people that might be different than before COVID and I mean people broadly more than just patients, but what from a sentiment standpoint, as we convene here in Mental Health Month, has there been progress that has led to better opportunities for treatment and even from, again, that piece of understanding oneself in the context of it's okay to not be okay and there are different ways to navigate the world and your way needs its own care, treatment, and direction sometimes.
Yeah, I think we're probably always going to see some juxtaposition of like an increased self awareness and the ability to sort of ask for help and ask for support. I think some beautiful things that did come out of COVID is for people who remained very isolated even prior to the pandemic, there's a lot of online support and a lot of, like Paul said, social media influence that has impacted people to sort of say, aha, oh, I didn't realize that this thing that I've been struggling with is something other people struggle with, and maybe I should get some support around it, which I think is a beautiful thing. I think we've also seen a lot of people lean heavy into like that social media or online support groups being the only outlet, which then has an impact of like the in-person social interactions and sort of connection. So I think there's sort of a coin toss there of like how helpful and increased access and increased awareness, which impacts people's ability to like ask for support and help. I think part of the work that the two of us do at Open Door Health and the Rhode Island Public Health Institute is really looking at different ways to be creative to increase access and decrease barriers and hopefully also decrease stigma. That has also sort of been something that in the last 20 years has gotten more and more prevalent in primary care, which is normalizing access to behavioral health supports while you're seeing your primary care provider. So I'd say like that's something that's also sort of come out of this is like, how do we normalize access and how do we streamline it in a way that's just more available with less barriers?
Right. The streamlining seems so important and something we certainly learned from COVID or through COVID in terms of brick and mortar and digital medicine. Let's talk about, to this point, how you and your colleagues at the Rhode Island Public Health Institute are working to address the issue. You run Open Door Health. That's a clinic which a few years ago launched the Open Mind Initiative. Let's talk about the Open Mind Initiative, what it is and how it came to be today.
Yeah, so the Open Mind subset of the services that we have at Open Door Health is essentially sort of the behavioral health arm of primary care. What I mean by that is our clinic is the first clinic in the state that specializes in LGBTQ AI plus healthcare. We serve everybody in the community. We are a sexual health clinic that focuses on primary care, gender care, Hep C, HIV and AIDS care, and a lot of other public health initiatives such as food insecurity and access to healthy food options, and a wide variety of other initiatives. And a couple years ago, I think in recognition of some of these gaps and barriers we were seeing organizationally, primary care providers sort of feeling really overwhelmed by sort of how do we help our patients who have this co-occurring piece of medical need and behavioral health need. And RIPHI and Open Door Health did a really good job of subcontracting with some psychologists and some additional folks through Brown Health to sort of start some behavioral health services. And then sort of predating me and sort of when Dr. Wallace came into the picture, the organization applied for a large grant to implement behavioral health integration in primary care. Um, and that was sort of a stepping stone for us to look at how do we do integrated behavioral health in primary care. Um, I don't know, Paul, if you want to add a little bit more, and then we can kind of cover more details.
Yeah, to get a little bit more in the weeds. So this program that was kicked off at Open Door Health and continues to this day came from a SAMHSA grant, which SAMHSA is the large federal agency that funds a lot of these innovative programs around behavioral health and substance use. And regular readers of the news will be aware that in January, SAMHSA was very much in the crosshairs of the current federal administration, and we're grateful to our federal delegation, which is involved in advocating for continued funding through SAMHSA for programs like this and programs around the country. But essentially, the genesis of this is just like what Jen was saying. This idea that um, a huge percentage of primary care visits are actually primarily about behavioral health. Primary care is the front door in which a lot of people first access behavioral health. And so the idea is with something like this, with an integrated behavioral health program like what we have with Open Mind, is providing the support that primary care doctors need and deserve to be able to address their patients' issues as it relates to behavioral health.
Yeah,
I
and
kind of
it
like
seems
to say that primary care is a whole health perspective. And when we do integrated behavioral health, we're pulling all those things together. And we're understanding that people's behavioral health impacts their medical care and their health, and that their health care might impact their behavioral health care. And when we align together as providers, we're able to better take care of all of the patient need.
Well, it also seems that there's an industrial agreement by and large that integrated health is the correct model, or at least the most likely to be successful in terms of general outcomes model. Yet, even with what we're describing right here, or what you're describing right here, is integrated health practices in practice. Why hasn't this been adopted writ large throughout public health and medicine in the United States? What's the barrier?
So I think Jen will probably have much to say about this, but I'll just say this is the $1 billion question. This could be the $1 trillion question, um, and and truly not being facetious, a lot of this has to do with funding streams and how our healthcare is funded in this country, and that is um, a topic that I'm unable to sort of put in a nice little package for you here. But again, a lot of this has to do with funding, which makes the world go round, including healthcare. And then the second piece is structurally figuring out how to do it correctly in a way that works for both the patients and the staff of an organization like Open Door Health. So, again, we're grateful for SAMHSA for funding this program and allowing us to develop those best practices, which then in turn we really do hope get mirrored, not only throughout Rhode Island but even beyond our borders. And there have been some initiatives, led by a few individuals at the Department of Health to really bring together primary care practices and replicate the best practices that we're developing at Open Door Health. So people are thinking certainly about how to scale this and make this a more widespread initiative. But as you can imagine, there are many barriers to make that happen.
Yeah, but there's also on the flip side, there's studies that show that this could save the United States somewhere between 40 and 70 billion dollars a year if it's implemented. So a lot of times there's two sides to that equation. I think it probably has a little bit to do with the nature of our healthcare system on the whole, but we are seeing a movement towards this in a lot of spaces that are shifting also towards kind of balancing telehealth and new AI technology, whether that's scribes or whatever it is. So how much of this is part of a broad ecosystemic shift towards, hey, there's a new model, it's integrated, and we're really heavily relying on technology and the funding that goes into that technology to deliver better patient care and then hopefully save billions of dollars for taxpayers. Is that kind of the trend right now? As is that a fair read of what is sort of happening on the ground at the Rhode Island Public Health Institute right now?
Yeah, I can jump in a little bit on that. So I think healthcare is very much so a reactive system. We wait until people are
Mhm.
really sick and then we figure out how to treat them, and it's sort of a problem fix it dynamic. And if we think about what I'm just going to say is being trauma informed care or preventative care, which we know costs more in the beginning, but the payoff is sort of exponentially more helpful and cost savings in the end. What we're talking about is investing more money that potentially will have less fiscal impact in the beginning. But quite literally, and integrated behavioral health is something, having worked in integrated behavioral health for almost 12 years now in multiple locations, is sort of like early intervention for generations of population, in particular if you're working at a healthcare organization that goes from pediatrics to adult medicine. I have been fortunate enough to meet with parents and children and grandparents and have there be this impact about decreasing stigma and increasing access and targeting things sometimes before they even start, when we talk about some chronic kind of conditions around social determinants of health and behavioral health and the intersection of healthcare that will have lifelong impacts on family systems. And so I really do look at it as like there might be this front end cost that is like, how do we figure out how to cover this in diverse funding streams and take care of people better, take care of a medical system better, change that system, help medical providers to do their job better, while knowing that the cost savings is indeed what you said, Bill, which is this huge amount of cost savings at the tail end. Less ER visits, less acute visits, less critical care things, less inundation of the rest of the behavioral health system, and truly would be transformative. But there have to be some decisions and some more public health kind of dynamics to tackle where the gaps end up being that makes it feel hard to do.
Yeah, Dr. Wallace, what are you seeing from your standpoint in terms of a movement towards integrated care as a practice that is kind of the norm? Do you think that's something that we're going to get to in the next decade, or is this a long, long haul?
Yeah, I mean, it requires visionary leadership because of what Jen was saying, that uh, you make a you make a front end investment that saves you, many billions of dollars down the road. But um, when you're, you know, when you're uh, to explain a bit, the traditional payment model in healthcare is something called fee for service, where you get paid based on the service you provide, no more, no less. And um, the way, for instance, Medicaid, Medicare, most insurers pay for, say, like a therapy appointment or a psychiatry appointment, it's quite paltry compared to something like, um, a uh, cardiology intervention or a knee replacement or something along those lines. So essentially, behavioral health ends up being a money loser for a lot of healthcare systems. If you're, again, just taking this narrow view of healthcare finances within a healthcare organization or within, if you're, an elected official, you might say, this is not a good investment. Now, if you're taking a more big picture view and saying, well, by treating this, this young person who is, having his first episode of psychosis now, you're going to allow him to stay out of the hospital. He's going to be able to complete school. He's going to be able to get a job, live independently. Again, the finances clearly, in the long view, clearly point towards investing in that care upfront. But once again, it really requires someone to take this whole person view and this long term view of how we fund healthcare, which is something that there have been movements to do this for, several decades now, and they kind of ebb and flow with sort of the winds of our sort of political system. But there definitely are people who are advocating for this within Rhode Island in the present day, and there has been some progress made. But unfortunately, like all of these programs that uh, you know, are vulnerable to the shifting winds of politics. We take one step forward and two steps backwards at times.
Last question here, sort of last 30 seconds each. What do you want people to understand about the work that you do that they may not understand? Jen?
So it's tricky to explain sort of behavioral health interventions because I think there's a lot of assumption if you haven't been a receiver of services. So I think that, from a care perspective, my job is to assist people in being as healthy and safe as they can be. Um, I think systemically for us at RIPHI and Open Door Health, we want to increase access and decrease stigma and really help people just be as healthy as they can and move forward in the world in a way that they feel like they can manage things as safely as possible.
Paul?
Yeah, I think the sort of stereotype of a psychiatrist is someone who's wants to push meds on people is something I'd love to dispel. I think most psychiatrists are thoughtful individuals who really want to look at whole person wellness, and that can include medications, but certainly includes talk therapy. And honestly, most of behavioral health happens outside of, like the four walls of an office or a computer screen if you're doing telehealth. And I know that's something, RIPHI and Open Door have been really forward thinking about whole person health. And so I'd encourage people who are curious about meeting with a psychiatrist to do so. It's a chance to have a conversation and, again, think about sort of whole person wellness beyond just medications or interventions that are more medical in nature.
Paul, Jen, thanks so much for your time today. Thanks for the great work that you do. And hey, this is Bartholomew Town.
Follow me on Instagram at Bill Bartholomew.